Thank you. Some touching words, and I will give Dr. Moody full credit for that we didn't provide notes. That came truly from Joel. And it touches on most of what we're going to do today and the real heart of this making a difference. We all are here. We know MSD solutions, MSD Prevention Solutions, you're confusing me with the name of your company now, work. Look, we've had numerous conferences when you've been here and heard about low-level exoskeletons. Do they change jobs, right? So normal ergonomics intervention, there's a problem, we react to it. What can we do to fix that job? The whole concept, thank you. This came from the audience over the last couple of years. At the end of the conference, you're going to be asked for feedback. There will be a link on the screen. And we go through it very seriously and look at the feedback we receive. And one of the comments that started to become more and more common was, the research is great, we like to understand what's happening, how do we do this? So the whole focus of this conference is very practical. The presenters are you. They're people that walk in these shoes, and they're going to talk to you about how they implemented these programs and scaled from solving small problems into culture shifts inside companies, okay? I want to also recognize our conference organizing committee from our health and safety system partners, our partners in the US, industry reps, who all had a voice in creating this. So if you don't like it, go talk to them, not me, okay? But seriously, they are almost all here 201. They are really connected people to talk to as well. So I already mentioned the two impact stories. These came about because of the points Dr. Moody was raising. We look at small scale, we read papers, we hear stories about people working and how it changes lives and changes that job. There's more here, right? We can have bigger impact than we're having when we react to things. And these are two really good examples. There's probably some more coming down the road that showed how they scaled from having a problem and building it up. So our goal, being an academic, I thought of this from learning objectives, so you may have flashbacks to your undergrad syllabus here. But the whole point was, I want you to think about these things going through. We are not just talking about preventing an injury. There's more going on here. In the current climate, many of these other factors are going to become very important to companies. Productivity, quality, skilled workers, being able to retain them and make sure they're not injured feeds into all of these other areas. Okay, so as you watch these programs, you'll see how other parts were involved. So I think I've crossed two parts off. So linkages to other systems and divisions. Watch how they integrated other people into their solutions. And number one, it's more than just injuries. The other one is what it takes. You're not going to do this alone, okay? So listen to how they manage to catch people and get people on board with these. You can be a champion, but you're not going to launch a whole program alone. Allison has some wonderful stories about capturing people on airplanes in a captive environment that they couldn't get away from her, right? So you'll hear these stories about how they shifted the tide. A little self-plug here. Don't recreate things. There is a wealth of resources available, both on our own prevention site, MSD solutions site, and other places. And they're not just our resources. We are portals to a whole bunch of resources from all different places globally. Culture. You're going to hear this word over and over and over again. I'm going to give you an example, hopefully to drive this home very quickly. And it was changing the mindset, okay? That it wasn't just about somebody not getting hurt. Okay, so you were nice and quiet. Let's make some noise. Come on, you can do better. Okay, perfect. If you wear an Apple Watch, hopefully you know exactly what I was just trying to do, right? And I've thought about this, and Einstein's up there, because not to compare myself to Einstein in any way, shape, or form, and this is the only thing that would be feasible to compare, this came to me on my bike. Because you're biking along and it senses wind, right? It's pressure for the noise in your watch and it's constantly going off. And I thought, how did hearing protection become so ingrained in our culture, right? It's a health and safety initiative. It's part of our OSHA laws or regulations. And then this one came up. If you've upgraded to the new iOS that came out last week, this is a new edition. And apparently I'm in trouble because I've exceeded my limit with my headphones. So it's not only telling you you're in an acute, loud environment, it's telling you chronically that you've been exposed to noise, okay? Hopefully you're seeing some parallels here to MSD prevention. Lifting something very heavy is like being exposed to something very, very loud. Doing something over and over again is a chronic exposure, just like having a certain noise level for extended periods of time. So there's wonderful parallels. How did they go from having hearing protection for people that were in very loud environments to it becoming common practice when we walk into a plant? How many of you haven't seen one of these? Probably in the last week. You enter the floor, doesn't matter what station you're at, you have to wear hearing protection on the floor. And they're readily available. So it's really became ingrained in culture, and I thought, this must have gone back a long time, but I'm also old enough that I remember as a teenager working in a paper mill, and people had hearing protection, but it hung around their neck. It wasn't a culture of wearing it. The younger people won't get this. And there's other examples I could talk, if I had all day, we could talk about helmets for skiing, how within a year, people went from not wearing helmets to all of a sudden wearing them. Like there were culture shifts. And the reason I'm raising this is what we need to do as MSD prevention people, is we need to make this become second nature to people. And I know a bunch of you are thinking exactly what Kim said to me, hearing's easy, all I have to do is put something in my ears. I will argue, and don't want to steal Allison's thunder, there are very easy things we can do with MSD prevention programs that parallel this. I'm not going to solve everything, okay, but there are things we can do. One of the beautiful things with noise, you've probably all seen these, the thermostat or thermometer one is from Australia, the actual table value is from Ontario, and it is a stoplight model, just like we use in Ergo. Green light, yellow light, red light, and it's how long are you exposed to a sound and how loud is it, okay? We have green, yellow, red light models in MSD prevention. Some of them are very simple, right? Postural based. Don't flex your spine down and lift something off the ground. And this is from the European Occupational Safety Agency. We have limits on time. If I'm in a good posture, I can do things for extended periods of time. And if in a mid-range concern posture, I can do it for less time. Bad postures, even less time. We can do this. We can induce this change in culture, and you're going to hear these stories. Okay. Dr. Moody already brought this up, but I'll just reinforce why do we need to still care about MSDs? We are making a difference, but in Ontario, there are 90,000 odd workplaces. There are not 90,000 people here. You are champions. I'm relying on you, and I'm putting this on your shoulders to walk out of this room and really change from solving problems to changing a culture. We still account for over a third of lost time claims in the province. It is the biggest cost to the system. And I will add, what's not on here is it is the disability that people live with for the longest period of their life. So if they're hurt or they have cancer, they have anything else, an MSD represents the largest lifespan of living with a disability. So you are truly impacting people, companies, all of it. This came from last year's conference. If you remember, WSIB presented this data. And I've reflected on it a lot over the last year, and there's a couple concerning things that add to this MSD problem. One is we're closing the gender sex gap. which in general is a good thing, not here. Women are going up, okay? And the reason that's concerning is I don't want some woman in the room to come up and challenge me to an arm wrestle or whatever. But on average, women have less joint strength than men. So they are a more vulnerable population. So their increase in injury claim rate is concerning. The other concerning factor is if you look at the graph on the right, historically MSDs were older males. And we've seen a big shift into younger people. So you can see the dip on that curve on the left, the green one, where it's all by itself. Those are young people now that the injuries have raised. Think back to what I just said about years living with disability. So now we hurt somebody in their 20s, and they're going to live with that for the rest of their life, potentially. Okay. All right, this is the other graph that came out that really started me thinking about stuff, and I know there's a lot on here, not my slide, we'll blame WSIB for this. A couple points I want you to take away. One is if you file a claim, usually it's about 40 days, you're back to work. There are a small number of claims growing that have secondary entitlement. And what that means is you can become permanently impaired, and once you're in there, a large percentage of those cases are compensated. What I really want you to take away from here is secondary entitlement, and that is if I have an MSD, it develops into chronic pain, and then I get mental health. And if you look at the column where it's average benefit cost days lost per claim, okay? And that's the second last column from your right if you're looking at the front. You can see if I have a dual claim of chronic pain and mental health, I'm losing 2,318 days from work versus 40 for an MSD. So if we can intervene and prevent MSDs, we're also going to intervene and prevent secondary claims for chronic pain and mental health. Think about that, 2,000 days. That's 6 years, approximately 6 years of lost time for a case with huge costs. So this ties this vision that you've heard. I think I presented this last year a little bit, and there's 2 resources here tied to this that we've developed. It's that MSDs are tied to mental health both ways. We've also looked at the association between an entry from an injury into painkillers and addiction. So those resources are freely available, and the message here is it's not just MSDs. It links into other health factors. And then workplace violence is the future of this because all of those contribute into that pathway as well. Okay, so back to what we're trying to do today. Myself included, we are all very good at the race model, right? We do this all the time. We identify hazards, we come up with solutions, we fix a job, we move on. What we're going to talk about today is how you go from that into a health and safety system program. So they're going to talk about these 10 steps. This is where it comes from. It's a free resource again on the website. I know MSD Solutions Lab also has their own program model. This is like right from the required health and safety approach that companies are required to have of a plan, do, act, check model. So there's nothing new here. It's just trying to say MSD shouldn't be treated alone. They're part of a health and safety system, okay? Okay, so our speakers, I'm wrapping up. Thank you. They are all here voluntarily. Well, maybe some arm twisting, but they are not being paid to be here. Okay, they've donated their time. I'm not going to talk about Paige. You're going to hear from her next. The other 5 are all practitioners. These are practical people that have walked the walk and talked the talk, okay? Ask them questions. You're sitting there going, how did you do that? Like, I don't understand this. Ask them questions, both in the room so everybody else can hear and individually catch them, okay? Not only are they practitioners, I think they're heroes, okay? Let's call them ergo heroes. Everybody know this movie? Who knows this movie? Big Hero 6, one of my favorite movies. So Baymax doesn't have anybody because, spoiler, he kind of dies at the end, but it's okay. He comes back to life. Okay? It's all good. Who knows who the arch villain is in this movie? I'll give you a hint. Professor Callaghan. Right? So there he is. There he is. Okay. So I will stop there.